Events like today, where both our organisations are working together, are massively important, I think, on many levels. I think we've both been in the space of development for many years, North West Employers particularly, and I think we've got a common purpose, a common aim, a shared purpose really, but working independently. Although since 2008 we've been collaborating in that health and social care space. And I think it's important, you know, especially now and understanding that future landscape and the need for our leaders across health and social care in the North West and wider public sector, faith sector, voluntary sector to come together. I think it's important that we collaborate and actually model that for the region in providing development you know, to those leaders. And I think even just bringing people into a space and the networking and the different perspectives that people gain from that is massively important. I think for us as well, what we've learned from each other and I think gained from our relationship has made that all the richer. I don't know about you.
Yeah, well, I'm not going to repeat all that because in true partnership style, it is about kind of complementing each other really. And I think a couple of things Deborah said are really important. I think today's really important for us as organisations, but for the people here. So I think what we're both committed to is providing safe spaces, so safe places for people to talk about where they agree, but also where they disagree, really. And I think if we can't do this as two organisations, then actually we shouldn't be out there telling other people they should collaborate, really. So we're on each other's boards, we talk about the programmes that we offer. So I think it's very important in the way we do this, that we're seen as collaborating, because that's part of our core purpose, really, to help people in the North West collaborate well and do the really difficult work we have to do as public services, really.
I think the thing that will make the biggest difference in terms of integrating health and social care is actually just getting started and doing some things. It seems to me that we often take an awful long time talking about things, trying to finesse things to the point where we think they're absolutely perfect, and actually starting and making a difference on the ground, I think is a big part of getting going.
And I think the biggest difference in the integration of health and social care is relationships. I think sometimes we try to force governance arrangements around particular projects and programmes, and actually what will make this work will be relationships at all levels within the system, whether that's at the senior level right to frontline workers, really putting those people at the heart of what we do. And
I think that's a really important point, because actually that is how also you'll start to build trust, is by actually starting to do some things. And those relationships need to be there to have the confidence to start, but the relationships strengthen as you actually do things together.
I would say the most important thing to say to leaders about taking integration of health and social care to the next level is to remember that there are leaders throughout the system, that this is not about looking to the top of the organisations for leadership, but for looking at that leadership at all levels. And I suppose my key messages would be brave, be communicative, so make sure you're out there and visible and talking to people and listening to what they've got to say. And then I suppose finally for me it is about making sure that you are building that environment within the system to enable that innovation, to enable that imagination to take hold, whilst being realistic about the risks that are involved in that process.
And I think I would add that there's something about just remembering why we all came into the jobs that we're in, and finding ways to really reconnect with your own personal values and your servant approach to the people that we are responsible to, and having that as something that feeds your purpose and your strength. I think there are lots of psychic vampires out there that drain your energy, and you need to find ways that actually strengthen your energy and feed it. And I think that's a lot about that reconnection with the people that we're actually trying to make a difference for. Success.
Leaders need to do two things to make a success of integrated care. The first is to build a collective approach across the NHS, local government and the third sector, with a common focus on the population they're serving and how they can work together to improve the health, well-being and outcomes for that population. That's easy to say. It's very difficult to do, because they have to develop the relationships, the trust and the commitment, the joint shared commitment to the population and how that can be improved. Then secondly, they need to particularly focus on service users and citizens. Much of what we're trying to do through integrated care is about improving the experience of people who require access to excellent health and social care services. And it's easy to lose sight of that in the discussions around organisational collaboration, sharing of budgets, technical issues like information sharing. But we lose sight of it at our peril, because unless we can keep individual people and how they may benefit at the heart of what we're trying to do, then leaders may easily lose sight of what's important. It's really important that clinical and professional leaders from across health and social care are fully involved in the work we're trying to do here, because the benefits will only arise if you get integrated teams and if you get professionals really owning and leading the changes in care and outcomes of care that are important to the populations we're trying to serve. That means protecting time, making sure they're not so fully involved in their clinical work and caring for people that they can't think about new care models. It means giving them support. So clinical leaders need to work alongside experienced managers as a partnership to bring about the changes that we're all seeking to achieve. And it means building on small early successes, so focusing on how teams can make a difference for a few people and then progressively extending that to much bigger population groups. That takes time. We need to be patient, have some urgency, but recognise it's not going to happen overnight. Health and wellbeing boards are one of the most important innovations in the last 2 or 3 years in bringing together NHS, local government, third sector and other partners with a common focus on health and well-being in their local populations. We need to make sure the right people are sitting around the table. Sometimes care providers aren't included. That needs to be rectified. Health and well-being boards need excellent professional support from staff in local government and the NHS. And they need to themselves invest in their own development, because the risk with health and wellbeing boards is they become talking shops. And if they're going to assume the greater responsibilities that politicians have spoken of, there must be a real work done to ensure they're operating effectively as teams, not as a collection of individuals who come together.
So my experience is that on the whole, people naturally feel they're in it together, and particularly when they start talking with patients, service users and carers. So probably the very first step you can take is to expose people to patients and service users' full experience, not just the bit when they're in their part of the system and their part of care. What we found is you've got to start with a question that particularly frontline staff, clinical staff, are curious about. So we tend to start with questions around variation, so where they think there's variation in practice. And we ask them to go and talk with service users and carers about where they think there's variation in practice. And of course what happens is service users and carers have different views, primarily from frontline staff. And then when we do the data and the background for them and say, well, let's have a look and see where there really is variation in practice, service users are nearly always right. And at that moment, you tend to get a real aha. And at that moment, you've got clinical folk who are really start to be interested in the pathway as a whole and people's experience as a whole. And the next thing is you can only do that as whole teams. So trying to expect people to feel like they're in it together and generate shared purpose from the standpoint of just their organisation is impossible. You have to do that across and only organised around patients' experience. So if you've then got GPs, clinicians, hospital consultants, nurses, nurse specialists, third sector, carers, families together looking at that experience, then suddenly you start realising that, of course, the consultant, the last time they were in a GP practice when they were doing their medical student training, well, that was years ago. They actually don't know how general practice is organised now. So then people have to start stepping into each other's shoes. So shared purpose comes from a real sense of being in it together and knowing what the problem is that's shared, and then spending some time stepping into each other's shoes and then saying, so what could we achieve better together? And at that point, you need system leaders at the top of the organisations to be saying, and we're prepared to support you to do that. What you don't need is system leaders at the top of the organisation developing a shared purpose and saying, you're in it together, whether you think you are or not, and therefore you need to behave like this. It never works. So people have got to a certain position of power based on their level of expertise and their knowing their part, particularly when we've come out of a culture of competition and markets. People defending their piece was what gave them both power, it gave them pay, it gave them authority, and that's quite a culture shift to say, actually, your job isn't just to look after your part, it's to look after the whole. Now, that's a big leap, and we're still regulated on parts, not regulated on whole. So, you know, our tops have got a really difficult job. So our executives, our chief executives, of making sure that their part works for an old-style regulating performance management framework, knowing that innovation only comes from the whole. So I think the biggest barrier actually is for the tops to find a way of understanding what in it together is. Because what we know from high-performing health systems is that when you're in it together, if you're really going to be high-performing, you have to give up territory. And there isn't any way that's easy to do that right now. So if you've got multiple CCGs in a patch, you've got multiple care providers in a patch, somebody has to give something up. You can't carry on and say, well, we're going to grow primary care unless you're going to shrink acute care. And that's always been a problem. But whilst people are rewarded for the performance of the parts, you're going to struggle to get any sense of the whole.
I think the 21st century public servant needs to be somebody who is a municipal entrepreneur, somebody who can be a steward of the sort of scarce public resources that we're going to have sort of now and in the future. I also think they need to be somebody who's really good at telling stories. We heard today about the importance of telling stories and how that makes an impact on people. And somebody that treats people as human beings and enables them to help themselves. And I think in order for somebody to be effective, they've got to have a range of the soft skills, so listening, relationship building, as well as that real sort of commercial acumen in order to make the best of the scarce resources that we've got. So we've been looking at the relationship between GPs and social workers as they're both the sort of the gateway into the health and social care sector, so they're really key people. What we found is that they don't really understand each other. They don't understand each other's value bases, and they don't really understand the roles and the responsibilities that they have. So what we're trying to do is to develop interprofessional training and development opportunities for them so they can come together and work on particular cases or looking at different care pathways and do that together, so that through doing that they actually start to learn about each other, start to learn about each other's motivations, about their value bases, and actually start to create a bit more trust between each other so that they can do the best for patients by understanding each other and just having a much better relationship and feeling more able to constructively challenge each other as well, because I think that's something that social workers in particular find difficult to challenge GPs. There's a bit of an unspoken hierarchy in the system. So by getting to know each other much better, we're hoping that we can overcome some of that.
I think some of the things that we've already planned for the future really are a reflection of the things that we've done in the past. So the first work that North West Employers and North West Leadership Academy did was some joint programmes for chief execs that was to help them develop coaching skills so that they could develop their partnerships and their organisation. And actually we still have chief execs in the North West who talk about that 5-6 years later really. So I think it's, as we look forward, it's trying to get that sustainability and to build that community of public service leaders who want to work together. So I think some of the things that we're already talking about are some joint work for those top leaders. We're also, as North West Employers, developing and would want to look to North West Leadership Academy as our key partner, an interchange, which is opportunities for people to have placements, shadowing opportunities, so that actually people lead and learn together in the North West, really. So I think those are some of the things we've planned as part of our joint discussions, really.
Absolutely, and I think the other thing that we've done is look at creative ways that we can do that, because we're very aware that we're both members organisations, so have those member fees coming in every year, and it's how can we actually not let the barriers of where the funding streams are get in the way of how we work together. So today's a prime example, really, as we've said earlier, where the provider arm of North West Employers have developed all of the event management, and actually that has allowed them to then have participants on the programme. So I think, much as other organisations are having to look at creative ways of asset management, etc., then, certainly that's the other way that we would like to look at things around how we can do some of this at no cost, really. So certainly looking forward to, many more years of collaboration.
Yeah.